Good morning.
Morning to you, Maria.
How are you?
I am doing wonderful.
Oh, good.
I was trying to get the ASPA background.
Let me see if I can email it to you real quick.
Thank you. I thought about that last night.
Let me see. I think it's on here.
Okay, I'll kind of make a real strong woman. That's my.
Okay, I just sent it to you, Lynn.
You sent it to my personal email or my work email?
Looks like your work one.
Okay, that's better. Okay, so Maria, how do I need to do a copy image.
You save it on your desktop or in a folder somewhere.
Okay.
And then in Zoom, down at the bottom where it says start video, there's a little caret up arrow.
It is pouring in my area.
Well, I was wondering, it's not too bad here right now. It was bad earlier.
Okay, Maria, once I get into Zoom, I go into view. Maria?
Sorry, I was muted. Down at the bottom of the Zoom screen, do you see the microphone and mute, and then next to the right of it, it says start video?
Yes.
So
Choose
click on the
background.
up arrow, click that up arrow where it says start
Right.
video, and then select choose virtual background.
Great.
And then it'll show your picture above and then virtual backgrounds under the picture. And to the right, there's a little plus box. So you click the plus box to add the image to this little folder.
Okay, I've got it. Why is it coming along backwards?
Down below, you can click mirror my video. Maybe that'll turn it around.
Okay, I just did. Thank you.
Yep. Let's see how it looks. Turn on your camera so we can see.
Okay.
You
I
got
need
it?
to go. Yes, thank you.
Yep.
I'll be right back.
Okay. Hi, Dr. Troisi.
Hi. It's a crazy morning.
Yes, it is. Never a dull
Hello, Dr.
moment.
Tracy.
Hi.
I'm glad that you're here.
Thank you.
How has your morning been so far?
Well, I did an interview on Sirius Radio from 10 to 10:30, and then I had class from 10:30 till now. They're still in groups, so I'm on WebEx and Zoom at the same time.
Wow.
Yeah.
Well, we appreciate the effort. Really do.
Well, it was my fault. They asked me to do the Sirius Radio yesterday at 11.
Oh,
And I thought, oh, I can do that, not realizing that was Eastern time. And usually my class is at 10. So anyway, it worked out.
well, I don't see Dr. Zhu on. So what's the weather like in your area? Because it's raining in my area.
Oh, it was pouring this morning and now
Yes.
it's cloudy, but brighter than it was.
No, it's pouring in my area now. So are you prepared for all the questions to come?
Yeah. You mean, do I have answers? No, I'm sure I don't.
Well, we don't expect you to have all the answers, but just being prepared. Let me grab a glass of water.
Hi, Dr. Zhu. Welcome.
Hi.
How are you doing, Dr. Drew?
I'm doing well, thank you. How are you?
I'm doing wonderful. Glad you're able to make it this morning on time.
Yes, I'm looking forward to it.
Yes, I am also. Weather is presenting a few challenges for us, but we'll manage right through it all. I'm going to go on mute. Do you have any questions at all before we begin at 12?
No, not really. Just a small question though. Do you have a particular order for the 3 speakers?
Well, one of the speakers backed out. Her mother is in the hospital.
Oh, I'm sorry to hear about that.
Yes, very, very sorry about that. She had to withdraw at the last moment. So we will have just yourself and Dr. Tracy. And of course, it's going to be a conversational style, like I mentioned.
Mm-hmm.
It's more like a round table. Oh, Dr. Thurman, welcome.
Recording.
Maria, if you're on towards the very last 5 minutes, based on the number of questions that are coming in, we'll just wrap it up.
Sounds
Like
good.
I mentioned to her, I'll be monitoring the chat as the questions come in, since she'll be focusing mostly on the presentation.
Great.
Wonderful.
Thank you.
And you do have enough questions, Maria, as backup?
I think so. And I hope that our audience will also pose some questions on this hot topic.
Especially given the governor's executive order this week.
Exactly.
So I'll go back on mute until we get ready to start right at 12.
Okay.
Look at my phone page.
What the hell? Where were you?
I'm going to pause the recording until we actually start.
Thank you, Leonard.
And I'll upload the video once it's finished processing onto YouTube because there's only limited space through Zoom.
Okay,
And
I thank you.
I think you all have the chat capabilities. You can chat amongst yourselves through the link.
I would like to welcome everyone. Good afternoon, good evening, good morning, depending on the time zone that you're joining us from. My name is Lynette Howe, President of the Greater Houston chapter of the American Society for Public Administration. ASPA is the largest and most prominent, broadly based professional association in American public administration, with a diverse membership of approximately 8,000 practitioners, academians, and students. ASPA serves as the principal arena for linking theory and practice within the field of public administration. Our goal is advancing excellence in public service. I'd like to thank you for engaging in this conversation regarding public policy and individual rights. Our moderator, Maria Modeska, will take us through this amazing hour. But before we do, a little bit about Maria. Maria Modeska, President-elect, currently serves as the Associate Director of Research Programs in the Engineering College at the University of Houston. She received her MPA degree in 2014 from the University of Houston program and continues a decade-long career in academia with a focus on research administration and facilitating research programs. She is a native Houstonian and has two crazy Dachshunds that keep her on her toes. Maria, the floor is all yours.
Thank you so much, President Howe. Welcome, everyone, and I'm very excited to be able to facilitate this roundtable discussion today on a very timely topic. And I'm so happy to have our two speakers who I'll introduce at this time. Dr. Ling Zhu is the Pauline Yelderman Endowed Chair and Associate Professor of Political Science at the University of Houston. Her research focuses on how democracy solves the problem of social inequality. Taking a policy-focused approach, she investigates the politics of welfare generosity, the institutional root of public preferences on the role of government in social protection, the political causes of health and healthcare inequality, and the governance of collaborative healthcare networks. Her previous research has appeared in American Journal of Political Science, American Journal of Public Health, Journal of Public Administration Research and Theory, and Policy Study Journal, among others. Welcome, Dr. Zhu. Catherine Troisi, PhD, is an American epidemiologist specializing in leadership studies and infectious diseases, including HIV and hepatitis. She's an associate professor in the divisions of management, policy, and community health, as well as epidemiology at the University of Texas Health Science Center Houston's Public School of Public Health. Troisi completed a BA in chemistry from University of Rochester in 1974 and earned an MS in biochemistry from Michigan State University in '75. Her master's thesis focused on the biochemical effects of polybrominated biphenyls on microsomal enzymes. Troisi completed her PhD in epidemiological sciences from the University of Michigan in 1980. Her dissertation was titled Influenza Type C, Antibody Detection and Epidemiology. Troisi was assistant professor in the Department of Virology and Epidemiology at Baylor College of Medicine from 1983 to 91. She joined the faculty at UT Health School of Public Health in 1997, and in 2010 was promoted to tenured associate professor. She's the coordinator of the Leadership Studies concentration and teaches courses on public health. In 2020 and 2021, Troisi has been an expert to the public regarding the ongoing coronavirus pandemic in Texas. Welcome, Dr. Troisi. So I'd like to start off jumping right in, directly addressing our title, The Intersection of Public Health and Individual Rights, which has the right of way. Historically, who has been the decider on which has the right of way? The federal, state, or local government? Is it the FDA? Is it the CDC? Is it the city, county health offices? How is it playing out right now for us in Houston and in Texas?
Okay, I can take a stab at all those questions.
Wonderful.
There has always been a tension between individual rights and public health. We know, for example, that there are many things we can do to make the community and individuals healthier. A soda tax would be an example. You know, drinking large amounts of soda is not good for your health. And in some parts of the country, soda taxes were passed. That did not happen in Texas. We have a very strong community culture of individual rights. And so what can be, it's this teeter-totter between individual rights and public health. Now, when we talk about infectious diseases, so a soda tax, if I drink too much soda and I damage my health, maybe there's some cost to society because if I have to be hospitalized, insurance costs go up, et cetera. But it's minute. However, if I am infected with a virus that can transmit between people, then, and I refuse to protect myself, I am damaging myself, but I'm also putting the community at risk. And that's part of this tension we're seeing right now, where it's not just if I don't wear a seatbelt again and I get in an accident, some cost to society, but I'm not really, it's monetary. It's not, I'm not causing somebody else to get in an accident because I'm not wearing a seatbelt. If I'm not getting vaccinated and I get COVID and I'm not wearing a mask, all those protections, then I can be endangering someone else.
Let me also add on what Dr. Troisi just said. And if we survey the long history and interesting human history of global pandemic and development afterwards in terms of government policy responses, we will soon notice that the current coronavirus pandemic itself is not a unique case, right? So throughout the human history, the way how these large-scale pandemics have changed our norms and acceptance about the role of government in promoting health and managing crisis. Quick example of this will be the famous 1918 to 1919 Spanish flu. Before that, the role of state, role of government, right, in using public health measures, making policies that will restrict individual level choices was not a prevalent idea, but it was the large-scale pandemic that actually invited the expanded role of government. So to that, if we think about similarity between that historical event and what we are experiencing now, and a lot of tension and ongoing debates about the role of government in managing health crisis, we would think about the pandemic yet being another continued historical lesson, right? That is transforming the way how we think about, again, the role of government in this particular area, as well as our society. In terms of the tension between public health and individual rights, let me say that wanted to kind of encourage the audience to think more about how we define and talk about public health, right? From a policy standpoint of view, public health is inherently defined and measured at the collective level, right? So we measure public health collectively in terms of the well-being of individuals, but at the aggregated level in a society, right? On a population base, when we make policy goals for improving public health, these policy goals are often made and measured at the aggregated level, at the collective level. That has policy implications, right? Which means that just as the wonderful example of soda taxation, Dr. Tracy mentioned about, I also wanted to mention about a similar example in European countries, which is cheese tax, right? So I love eating cheese, but in many European countries now, in thinking about dealing with the rising trend of prevalence of obesity, some countries are actually making cheese taxation and try to use that as a way, right, to disincentivize overconsumption of fat-enriched product. So these examples are wonderful kind of illustrations of how a public health policy goal, right, is used as a justification for inviting policy measures that will result into restrictions of personal choices. We've seen a lot of ongoing debates and even political episodes, right, in Texas and outside of Texas during the last year, talking about early time restrictive interventions to the COVID-19 pandemic and backlash from the public, right, mass protest against mask mandates, parents craving for reopen of schools, right, protest on the streets asking for the reopening of the business, despite that scientific evidence suggested those early time restrictions matter and work effectively, right, in slowing down the spread of the disease. I think deep inside, this is less about the question of science or information. This is the fundamental question in our democratic system, right, regarding to what extent our public would accept, right, the limitation of their personal choices and give our government the legitimate power to restrict individual restrictions. So those are my thoughts behind your question.
And I think what you just said is really to expand on perhaps that tension or the relationship between the policymakers and the public health PhDs, doctors, et cetera, that how do they work together? It doesn't, in my view, it doesn't seem like they are working together very well, or there's a lot of confusion. And it's, as Dr. Thurman pointed out in an article he sent me, it's a wicked problem they talk about in public policy. This is a wicked problem. How do you see in both of your experiences with your colleagues in working and having conversations about the pandemic and how we're all dealing with it, that both sides can come together somewhere, or are there examples where you see that working together really well?
Yeah, that I'm not sure I see that working well in Texas. Certainly there are other states where policymakers are following the science more. And, you know, one of the questions you had asked originally about who makes these decisions under the Constitution, because public health was not listed as a purview of the federal government, it's left to the states. And that's why we see every state having its own specific response. Would we be in better shape if we had a national response? Probably, but that's not the way we're set up. So the CDC can make recommendations, doesn't mean the states are going to take it. There was a famous court case, I believe it was 1905, Jacobson versus Massachusetts, where there was a smallpox outbreak. Mr. Jacobson did not want to get vaccinated. It went all the way to the state. Massachusetts was saying, yeah, you need to get vaccinated. This is a communicable disease. You know, you're putting the community at risk. went all the way to the Supreme Court, and the Supreme Court ruled that the state could require Mr. Jacobson to get vaccinated. Now, in the end, he paid a fine, and it was, I forget, like $1.50, which I'm sure was worth a whole lot more back then. But, you know, he didn't get vaccinated. He paid a fine, but the state had that right. I'm not a lawyer, but it's been interesting to me that this Supreme Court case does not seem to be followed in our response to this pandemic. And now I've forgotten what your question was because I got off on a tangent.
I was referring to relationship between the two sides and how are there examples of good working relationships, perhaps, hopefully in our community?
Yeah, you know, I teach a course on principles and practice of public health, basically Public Health 101. And every day I say to my class, public health is political. In fact, one of the students just joked on the midterm, she's just going to write politics for the answer to every question. And should it be that way? Probably not. There should be a little bit of science in there. But in many states, and I would put Texas among them, we haven't seen a lot of emphasis on the science of preventing COVID transmission. It's been very, very political. You know, and I don't know who's whispering in the governor's ear. Maybe things would have been worse if there weren't advisors that were doing that. But I would not say, and I have to be careful because I'm a state employee. I wouldn't say that we have done the best job we could in controlling this pandemic.
Dr. Xu?
Yes, I also want to say that in terms of the cross jurisdictions, right, in which levels of the government has the authority in regulating or mandating these public health measures, I think US is a very interesting and somewhat unique example in terms of how federalism in this particular context, right, may decrease the efficiency of our responses. What is worse is the polarized political context, right? When you have a large country, federalist system involves coordination vertically and horizontally to respond to such a large scale public health crisis. But if the political environment is less polarized than what we have now, probably we'll see better coordination, right? So I personally see that from the policy implementation perspective, we are lag behind in rapid responses, in efficient, effective responses. I see this more like a failure in collective action, and part of that, again, is the competing voices and competing preferences that we see between federal government and states, and also within states, right? So if you think about our interesting case of Texas, where if you see early on last year, measures adopted by Harris County and City of Houston and other major cities within Texas, and how these policy measures have evolved, right, over the course of last year, we did see tensions or lack of consensus between local governments, which is the front line, right, in implementing those public health measures, and our state government. And we still see the ongoing policy debates, and the upcoming primary election and electoral cycle is only amplifying these political differences rather than reconciling them. So that's my first observation. But the other interesting aspect I do want to bring onto the table is about the structure that we have in terms of fiscal resources and incentives, right? And it's interesting that on the one hand, states are having a large amount of discretion and authority in regulating public health issues, but on the other hand, in the actual process of delivering medicine, vaccination, right, even disseminating information, there's a lot of vertical collaborations, and states are dependent on federal government in some regard, right, for resources. So I see the disconnection between the incentive structure, right, regarding the fiscal resources in responding to pandemic, and the political battle over the turf, right, in terms of who has the ultimate authority in regulating and mandating policies and making regulatory policies that will limit individuals' choices. So I find that primary reason why we don't see very effective responses from our state and perhaps other states as well.
Yeah, and
Thank
I
you.
would add to that, I think you're entirely right, Dr. Su. If you had asked me 2 years ago what would happen if we had something like this happen, a pandemic, I would say people would come together, we would, be united against this common enemy, such as happened after 9/11. And yet we saw the opposite due to our political divisions right now in the country. In a sense, this pandemic couldn't have come at a worse time for the United States because of that.
Wow. Yeah, I'm glad you brought that up because it's very telling in a way, and such a pity, just like you said, how unifying the aftermath of 9/11 was for the country. Let me remind the audience that we welcome you to post questions in the chat, and we do have one from Justin Mayberry, and I wanted to see if I could call on Justin, if he can just read that out for us. If you could unmute yourself.
Hear me?
Yes.
Okay. I put in the chat, I might as well just read it. Is there even a way to reach certain segments of the population because things have become so insular and political, and it's very easy to confirm your beliefs online in seconds? Y'all were talking about after 9/11, a sense of community, a sense of, coming together as a nation. When the polio vaccine became available, it was a major national push, and that sense of collectivism was present with lines forming for blocks. Is that even in the realm of possibility today? Will it take someone in government, which would likely be Biden, just taking a massive hit politically and mandating the vaccine? And should he even do that?
So you bring up a number of good points in there, Justin. First of all, when 9/11 happened, we didn't have social media, and that has, as we all know, played a big role in the misinformation and polarization that we've seen in response to this pandemic. The polio vaccine, you're absolutely right. I was 2 years old, showing my age, when that vaccine came out. You can Google it. My mother talked about how she couldn't wait to get me vaccinated because polio was very, very scary. However, we forget that there were some anti-vaxxers around then. Now, it wasn't as loud as it is now, but there were still some people, even with the smallpox vaccine, there were people who, there were political cartoons that showed people turning into cows after the vaccine. So there's always been some resistance, but certainly not what we see today. The message is certainly important. The problem is that public health, which used to be trusted, is losing some of that trust from the public. And CDC has unfortunately made a number of missteps in communication. It's going to be important to get that trust back. And when you talk about, for example, the vaccine mandate, if you look at public polling, people are in favor of mask mandates and vaccine mandates, but the politicians aren't listening. Does Biden need to do it? We'll see in the courts who has supremacy, the federal law or the state law banning mandates. Again, not a lawyer. From what I've read, people think that it's the federal law that will, but we'll have to see. But it certainly may hurt him politically. I am surprised by healthcare workers who do not want to get vaccinated because, particularly healthcare workers, they're putting patients at risk, and that to me, that just isn't right. The part of your duty as a healthcare provider is first do no harm. So I've rambled.
to add on Dr. Choice's point, I think it's not just the decline in trust in science or the impact from misinformation, right? From different venues that make the public confused even about the efficacy of vaccination. It's also the question about, again, whether our government has the authority to mandate that, right? Glad that Justin, you mentioned about interesting case of the polio vaccination. So US scientists definitely won this, right? I made it to the Times Magazine People of the Year in the 60s. Another interesting parallel example is in the mid-19th century when the UK government made the smallpox vaccination compulsory. It generated local anti-vaccination responses. But the opposition was less so to the vaccination itself, rather to the role of government in mandating vaccination. I think today that historical example still speaks to the COVID-19 scenario, where we see the decline in the trust in government right across the board, and the decline kind of support to letting the government to mandate. I think deep down inside, maybe American people have that psychological attachment, not wanting the government, right, to tell us what to do or what not to do. In terms of the question about will that be a promising route, right, moving forward? I personally don't think a single design, like single policy design based on paternalistic mandates will work. At least, state of Texas has proven that this make the implementation process very hard, right? So they're always generating strong oppositions. We do have other measures and maybe bundled kind of alternatives together with mandates may work hopefully more effectively, such as a better public health information campaign, right? There needs to be, more scientific voice in our general public discourse on health issues. Perhaps we could think about bringing incentives, right? Incentivizing healthy behavior rather than punishing unhealthy behavior only. We should think about multiple designs of the policy tools and interventions rather than being very fixed on just using paternalistic ways. I don't think this is the only policy venue that public health authorities can think of. So that's my kind of thoughts behind your question. I think probably all of us are interested in, are we doomed, right? Moving forward, what if there may be another wave in the spring? What should we do? I think there needs to be more than just mandates.
And along that line, I'm not sure if it's paternalistic or not, but how did we do in Houston with the incentives that were put in place for $100 to get vaccinated, for example?
We saw a big increase in number of people getting vaccinated with that. And thank you for bringing up about incentives. I absolutely agree that, you don't want to get vaccinated, fine, but then you can't, like New York City is doing, then there are consequences. It's like with your children, right? There should be logical consequences to behavior. You can't go to that restaurant. You can't go to that concert. I think incentives are really going to be the way to go, except, again, I would make an exception for healthcare workers and people who work in long-term care facilities where the residents are at such high risk of dying should they get infected, where the vaccine, no vaccine is as effective as you age. They have a responsibility not to infect others.
Agreed. I see there's a question from Dr. Thurman. Would you like to read your question if you unmute yourself, Dr. Thurman?
Yes. Maybe this is old history though, but I always was amazed that in 1964, when cigarette smoking and tobacco was declared to be harmful to your health, and the federal government followed it up with rules and regulations on advertising, one thing then another. And at that time, if you look at the old movies on Turner Classic, everybody smoked. The movies are full of smoking, and we didn't see that for years and years. And maybe it's coming back now. But my whole point is, I wouldn't want to get between somebody that's a smoker and his or her cigarette, But we did, and we made it work. Is there any kind of parallel or something from that we can be used? Of course, at the same time, that was before the Vietnam War, before all this stuff, Watergate and all this, when the trust in government was high in the early 60s. But that was just my thought. Is that a good example or not?
You know, the control of tobacco substances is a major achievement of the 20th century in public health. And it's really due to a number of approaches. One, as you mentioned, is you don't see people smoking on TV or in movies anymore. So it's changing social norms. The workplace and restaurant requirement or regulations that you can't smoke at your workplace or in, well, that's not true everywhere, but in urban areas. There are still rural parts of Texas where you can smoke in restaurants. Has really just made it harder if you're a smoker. The tax on cigarettes has really led to a decrease in smoking. So there's the policy issues. It's been a multi-pronged approach to control, to decrease smoking rates among people. And now we're dealing with e-cigarettes and what to do about those. It certainly has been a success, but in this case, you're not doing something versus getting vaccinated or wearing a mask, which is doing something. So I think there's maybe a little bit of difference, that it's not the perfect analogy.
And let me also add that glad that Dr. Troy mentioned about the changing norms, right, a long time. That our social norms about smoking decades ago have been completely changed now, given the development of science, discovery of the negative consequences of smoking. We no longer see this as a cool, fashionable behavior, right, on movies or on TV shows. The evolving norms has changed, I think, the public foundation or support for inviting more restrictive regulations or coupled with public health interventions in this area. However, I think in the kind of wave of the coronavirus pandemic, our norms are not there yet. We still have debating conflicting norms or beliefs, right, at the individual level in our communities regarding mask wearing, regarding taking vaccination and other health measures. I personally think that the pressing question is, in an urgent situation like this, we cannot wait, right, until norms to be changed. What should we do? What are the likely areas that we can potentially see positive kind of changes rather than the status quo? One thing I'm amazed, just my personal observation about last year, is on the one hand, how our government may still be engaged with policy debates or sometimes political fights about these regulations, but on the other hand, we do see at the community level, individuals do voluntarily, right, undertake, at least some individuals in our communities, these protective measures, right, sacrificing their own leisure time, try to reduce the time of social activities, and etc. I see that trust among ourselves, right, and being very important social capital, and empathy toward each other being a very important social capital, especially in the absence of a clear set of regulatory frameworks dealing with the pandemic. I think maybe, as James suggested, an information campaign, right, together with a grassroots movement, making use of our social capital may shed some hope moving forward. If we have forgot about empathy toward each other, we're doomed.
Good point. And I'm curious about the messaging from the public health perspective, or the more positive messaging that I know it's out there. Is there something that needs to be changed to reach a broader audience, or a younger audience, or an older audience? I don't know.
Yeah, we are certainly learning about best ways to communicate, and certainly we need different messages for different audiences. Unfortunately, There may be some general guidelines about communication, but it's really a trial and error, seeing what works. And you're battling social media and the misinformation out there, which makes it very hard. And it's, you know, I can say as a public health professional that the COVID vaccine is safe, that it will protect you. But if you are, you know, we all have confirmation bias. And if I have read on, if you have read on social media, that isn't true, that it's, you know, the vaccine's going to kill you, you may not believe me. You're going to believe what your friend has said on social media.
Mhm.
Maria, we have an
Yes.
interesting question in the chat. Can I go ahead and read it? It says, guess
Yes, please.
why federal government and its agencies do not talk about natural immunity and give conditions to those who have natural immunity?
I can answer that question. The
Wonderful.
reason is that while it is true that if you have been infected, some people who have been infected with COVID will have natural immunity. We don't know how long it lasts, and not everybody develops immunity. Therefore, we have a recommendation that you get at least one dose of the vaccine, even if you've had the virus. Whether 1 or 2 doses, you know, those studies are still being done. But just because you've had COVID does not mean that you can't be reinfected and spread it to others.
Hmm.
And there's a question here from Angel Leon. I believe the tension between personal liberties and public health is improperly framed. When someone chooses to consume unhealthy foods, the consequence is personal. However, when someone refuses to wear a mask or get vaccinated, they put the rest of the community at risk and burden our healthcare system. I'm willing to argue that someone refusing to get vaccinated is an infringement of my right to a safe living environment. They are threatening my life. What do y'all think about that?
I can go.
Yeah, I would totally agree. And there's somebody, I can't remember who said this about your, you know, when talking about free speech, your right to, let me see if I can phrase it right, but your right to free speech, something about punching you, you know, it ends when your fist hits my face. I'm messing it up.
Yes, I know that one.
Yeah. That, yeah, again, I may have an individual right not to wear a seatbelt, although that's a federal law. But my not taking precautions, not getting vaccinated, not wearing a mask affects you. And that's where the idea that we can't have, for example, mask mandates, to me, does not make sense. We're not asking you to cut off your right arm. We're asking you to wear a piece of cloth over your face to protect yourself and others. To me, it seems like a no-brainer.
Yeah.
Yeah, I think this is a great point. A lot of regulations and public policy interventions, not just in health area, but in other areas as well, are invited and legitimized because individual behavior may create negative externality, right, to the society or infecting other individuals' well-being in a non-voluntary way, negatively. So coronavirus is just another running example. The interesting comparison between we now accept the norm of letting government to regulate our driving behavior, right? Because dangerous driving behavior will create consequences, negative consequences to other individuals. Yet we are still debating in a realm of public health on a lot of issues, not just for this pandemic per se, right? Whether our government can regulate unhealthy behavior. Perhaps part of that again gets back to how society, how ourselves take this as the norm, right? I'm optimistic that the pandemic, like the current one, is going to changing our, way of thinking. The question is how fast, in a location like Texas, right? How effective we can build that consensus. Again, I think perhaps we would wait longer time in Texas comparing some other states, right? So given the political environment,
Yeah.
indeed, infectious disease prevention and management of that is political along human history.
Mhm. I see Shreya Sadev has their hand up. Would you like to ask your question?
Sure. So what I was going to say is that I do see that there is hope. You know, in my family as well, there was a little bit of hesitancy about the vaccine in the beginning. And I think we understood that, you know, we need to trust science, we need to get vaccinated, and we all got vaccinated. And, you know, that's amazing. Like recently, my brother got vaccinated, all of us vaccinated. So I think that choice that we made has really helped us stay safe. But also, do you think there's a way that we can sort of protect ourselves without having to enforce other people to wear masks? I know it's simple as wearing a mask, but what if about like a, what is it called, like a vaccine passport, or like a way to know that, how can I know that the people around me are not vaccinated and I can sort of keep my distance? If that makes sense. Like, how is there a way that we can implement that so that we can protect more people, even if people are not willing to get vaccinated or wear a mask?
That's a hard one. I mean, I think of the book, The Scarlet Letter. Like, how are you going to have some kind of symbol or outward indicator that that's the case? I don't know how we would do that.
That's part of the issue that and when the CDC came out with their recommendation that if you were vaccinated, you didn't have to wear a mask, that was why it was changed. First of all, it was before Delta. We didn't know so much about breakthrough infections, but also I don't know whether you're not wearing a mask because you're vaccinated or because you don't believe in wearing masks. And unfortunately, if you look at the Venn diagram of the overlap between anti-mask and anti-vaccine, there's a big overlap.
We've got a lot of questions.
Maria, you ready for another question?
Just quickly, I think part of the policymaking challenge here for this particular pandemic is that the virus itself is new, right? Even though U.S. has the best science in medicine in the world, we're still studying the virus. We're still studying the course of how in itself may mutate and how that has ample implications for, you know, our strategies in dealing with the pandemic. In such a learning process, again, if we have really polarized public and polarized political system, it only will slow down effective policymaking, to my understanding. Every debate, even around scientific information or new discovery, right, in the medical science, will become the kind of forum, right, for political debate. And then quickly to the question about how we can protect ourselves in such an environment, I think it's very, very difficult, right? Without clear information about who surrounding you, right, are vaccinated or not, and without consensus about what will be the best measure, it becomes very challenging. That's why we need good public health, right? So when individuals themselves cannot achieve the optimal goal of protecting our own well-being, we do need the public authority, right, to coordinate the collective action.
Thank you.
Maria, the next question coming from Mr. Adekanbi. Can I go ahead and read it for you? To what extent can we say our institutions have contributed to this quagmire? I say that given this history of secret dealings in their modus of operandi and the lack of trust related to public information, I am equally aware of the need to manage operational information and privacy. However, some people are reluctant to take the vaccine as they do not trust the government. What would you recommend our institutions do to address this issue?
I think the issue of trust is a very big one. And if I knew what we should be doing about that, I'd be writing a book and winning a Nobel Prize or something. I don't know. I think part of it goes back to our education system, particularly about science in our country, when people believe that the vaccine has a microchip in you that in it that people can track
Yes.
you. First of all, what do you think your smartphone's doing if you're worried about being tracked? But maybe if people understood more about how about science, that would help. It is true that the government has not always acted in an honorable manner, and Tuskegee is often brought up. But at some point, I think, and I am speaking not as a African American, but I think at some point you just have to get past that, and have a little more trust in government. Yeah, I mean, it's a hard question. I don't know how you get trust back. And certainly some of the missteps early on in this pandemic, and as doctors have said, we're still learning about the virus. Again, part of the lack of understanding about how science works is people who say, well, you changed your mind about it. Yeah, that's how science works. We get more information and we change our recommendations. We're learning as we go with this. And so, masks are a good example of. At first, there were very good reasons to not recommend wearing a mask. That advice changed.
And I also think that given the current regulatory environment within our own states, right, it seems that even our local governments will have very tight hands in terms of mandating or asking, wearing a mask or vaccination in a compulsory way. However, I do see some possibility of maybe coalition building and to mobilize voluntary behavior, right, across different sectors. There has been some common ground, right? The business sector would like to make sure that they have a healthier workforce so that business operations can continue. They'd like to have healthier customers visiting their stores so that business gets to continue, right? School environment, like our universities facing the regulatory environment, that we go back to the normal teaching schedule on campus. We want to make sure that faculty members and students are healthy enough to sustain the teaching schedule. So I wonder if this may be in the absence, right, of the possibility of pushing forward mandates, at least at the local level. I think that may be a future direction we all need to think about, right? How to build a coalition across different sectors to incentivize and mobilize voluntary behaviors in the individuals and organizations that are already willing to voluntarily comply with these kind of recommendations, to make that voice stronger, rather than stay with the debates about whether the government has the right to regulate or not.
Mm-hmm. And I see Dr. Majumdar has her hand raised. Do you want to go ahead and ask your question?
Yes, can you all hear me?
Yes.
Okay, so it's a very interesting discussion, and thank you, for your opinions and your presentation. I really appreciate that. So, this is what kind of, is interesting is the state government considers the local government as its creation. And it allows the local government to operate with its own like rules, regulations, etc. And then when the time comes, the state government does not stop to seize the authority from the local government to impose a mandate. Like it has happened in several towns, in several cities. And like, for example, like all the restrictions, etc., that the city of Houston would like to impose. Now, the state government steps in and said, no, you can't impose a mandate on vaccine, etc. Now, the very fact that there are, the hospitals like Methodist, Memorial Hermann, etc., they require every employee to be vaccinated, and if not, they'll be terminated. So you see over here the clash between the private sector and the public sector and the local government with its hands tied over here. So this is a very complex thing, even when, an incentive is used, like, like monetary incentive to get vaccinated. So, it doesn't work, if we do not, work together, whether we are in the public sector, local sector, and the government at its various levels. The very fact there is so much dissonance between the different components, that's why we are in such a sorry state right now. So that's just my comment and my observation based on what I'm seeing, I'm hearing, etc. So thank you.
Thank you. There is a question in the chat here from Giovanni Rosselli. Considering all that we've learned during this pandemic, what would be your key point or points if you were advising a future president in how to handle the next pandemic?
Well, interestingly, I'm not advising the president, but I am on a panel next week at the American Public Health Association talking about this very issue. Our response to the next pandemic, there will be another pandemic. If we're lucky, it won't be for 100 years, but it could happen next month. No guarantees. I think that while our technical solutions in this case were pretty good, not great, the testing fiasco at the beginning, we did not take into account the social responses and the politics. I think we need to be much more cognizant of that going forward. Funding for public health has been underfunded forever, basically. And we need to understand the role of public health in this roller coaster funding, this panic and then neglect that public health gets. It just doesn't work. We need to have a strong infrastructure. We need to concentrate on workforce development. And indeed, a lot of money is going, at least for a couple of years, into that. The Texas legislature has approved the Texas Epidemic Public Health Institute, TEPI, we call it, and workforce development for health department employees is going to be part of what we do for that. We need to have more robust surveillance systems. If you'll remember, some of that funding was stopped during the previous administration, but we need to know what's happening in other parts of the world because that's likely where the next spillover event is going to occur. I would suggest we need to at least look at having a new international agency. WHO has, first of all, it gets very little money and is under political pressure from member institutions. Maybe we need a different model for pandemic preparedness and response at the international level. We need to incorporate the One Health model into our surveillance. One Health is the understanding that the environment, animal health, and human health are all interrelated. And so we need to pay attention to all those three aspects. We need to think more about just like we're talking about today, these interactions and tensions between individual rights and public health interventions. And where do we draw that line? Maybe thinking about it ahead of time for various scenarios would help us respond faster. The other thing we haven't talked about is the role, here, it's certainly been talked about a lot, is the role of social determinants of health. You can say that if you're sick, you should stay home and not infect other people. But if you don't get a paycheck and if you stay home, if you don't have paid sick leave, and so you're not able to put food on the table, then you may make the choice to go into work. That's an issue. Access to care, poor housing, all of these are many of the reasons why we saw such higher case rates and hospitalization and fatalities among people of color, communities of color, because of these social determinants of health. So we need to look at that. We need to understand that there are institutions, for example, long-term care, prisons, schools, where transmission is very likely to occur. We saw a lot of transmission early on in our long-term care facilities and still going on in our prisons. So we need to look at those as sentinel testing sites and prevention. I would also say, in terms of communication, we need to be culturally competent. And as we talked about, tailoring messages to different communities, and you have to have the right messenger. I am not the right person to go into a community of color and talk about how safe the vaccine is. They need to hear that from someone that they can relate to better. And then we need to, as Dr. Zhu mentioned earlier, or maybe this was on my previous call, I forgot, I'm sorry. Had a long morning, about this Swiss cheese model of defense that, you know, one thing isn't going to work. We need to do a lot of different prevention methods, and nothing's perfect. And hopefully if you do enough of them, you know, if you think of Swiss cheese lined up, that it may get through one, the virus might get through one hole, but it'll be stopped by cheese on the other slice.
Oh, I like that analogy. Dr. Zhu, your
Yeah,
views on
sure.
this?
Dr. Tracy almost mentioned about all my talking points. I actually have, you know, assuring adequate public health infrastructure, promoting health information, more effective emergency preparedness, all my talking points. But I wanted to add my last point to this, like moving forward, if we want to better responses, right, to another pandemic like this, or, you know, improve the current situation. I think the challenge part and what we need to do better is to make a better connection between our best science and our policymakers. I think the United States last year missed maybe the initial couple of months of golden time in making rapid responses to this pandemic early on, partly because our best scientists and best experts recommendations were not heard, right, or not adapted enough adequately in the policymaking process, and that was a mistake. Should we, you know, listen to them earlier, sooner? Probably the spread of the disease will be contained more effectively, let alone the economic loss and suffering many households and many families experienced last year.
Thank you. You mentioned rapid response. I think of how well Houston Harris County area does in response to hurricanes. We have that ability. Let's turn it into this rapid response for fighting pandemics as well. Well, thank you both so much. This has been an excellent hour. I'm sorry we didn't get to everyone's questions. We still have a lot of questions in the chat, but this has been so informative, and I'm so appreciative of you two taking the time to talk with us today. Thank you so much. And I'll turn it back to President Howe. I think you're on mute. There you go.
Yes, President-elect, all the students, academia, panelists, and of course, Dr. Thurman, Dr. Chan, all the ASPA executive leaders. We value your efforts today. We value your contributions. The panelists, you have really blown up the chat box. Like Maria said, we're unable to complete all the questions that we have. It's been a hot topic. It's been a very controversial issue, and we can't seem to get enough good, solid information for us to walk away with. You have left it with some great nuggets for us to take with us today. Dr. Tracy and Dr. Zhu, we value your efforts again. It means a lot to ASPA. Please look for the video. Mr. Chan, who has done us the honor, will be providing the video for us to view. I can't thank you enough again. We have exactly 2 more minutes. If there's anyone else who would like to make a comment. No comments? Okay, I'd like to thank you all. Enjoy the rest of your day.
Thank you very much for having me.
You're welcome.
Thank you.
You're
Bye-bye.
welcome.
Bye-bye.